Hello everybody, I am Young Kim from Dongguk University. My topic is how a drug candidate for the antioxidant properties as mediated with the signaling pathway. 이 경력만 한국말로 말씀을 드리면 저는 이제 한의대를 졸업하고 약학과 한의학 박사를 취득했습니다. 그래서 방제학회 회장을 거쳐서 지금 현재는 편집위원장 방제학회지 그리고 제임스 편집위원을 맡고 있습니다. 그리고 빔이 어디 갔지? 여기 있네요. 네, 현재는 한약과 합성약과 한약의 이런 약물 상호작용에 대해서 연구를 하고 있습니다. Okay, there are two approaches in the traditional medicine. As you know, first is acupuncture and the second is herbal medicines. Today, I will talk about the herbal medicines. There are also two approaches to study herbal medicine. The first way is the scientific approaches. We can analysis by fractionation and synthesis of the herbs. And the other one is oriental approaches. We can mixture and make prescriptions to treat the human disease. This is the picture of liver. The left is the traditional medicine. The right side is the Western medicine. I think this is a different vision, but same purpose to treat humans. Chronic liver disease. The liver disease rate of men is double in female, and the potential liver dysfunction rate is 1 out of 6 men. However, a limited number of therapeutic agents are available. This is the stage of liver disease. The viral infection and metabolic disorder and alcoholic and non-alcoholic fatty liver disease can induce fatty liver and hepatitis and fibrosis and cancers. So, to treat the liver disease, the initial stage, such as oxidative stress and inflammation, is best strategy to treat liver disease. As I said to you, the inflammation and oxidative stress is the initial stage of liver disease. Chronic infection and pathogens and the cigarette smoking and alcohol abuse can induce cell and organ injuries. This is the picture of stage of liver disease based on the molecular pharmacology. As you can see, this is a normal hepatocyte, but if the normal hepatocytes have oxidative stress and fat accumulation, the hepatocyte injury happened, and then this is go to the inflammation and apoptosis, or the various hepatitis can induce the fibrosis and cancers. This is the signaling pathway related with hepatocyte injury. As you can see the pictures, the PI3 kinase and LKB1 AMPK pathway to inhibit oxidative stress and as well as the MEG-NRF pathway can inhibit oxidative stress. In the aspect of inflammations, NF-kappa B prostaglandin can induce inflammation, and cytochrome and caspase pathway can induce apoptosis. And TGF-beta and HIF-VEGF pathway can induce fibrosis and cancer metastasis. And how can we regulate this signaling pathway to treat liver disease? I will talk about the pharmacological interventions. The first topic is AMPK pathway. As you can see the picture, the red wine, the resveratrol in red wine, and the metformin, the anti-diabetic agents can induce LKB1 and AMPK pathway to treat liver disease. This is the example of my papers. The solidmycin, a drug candidate, can prevent oxidative stress by inducing AMPK pathways. This agent activates AMPK and autophagy, and then reduces the RS productions. This is another example. The fucoxanthin in Dashima can prevent oxidative stress. Especially fucoxanthin, yesterday, Dr. Sang-Chan Kim called me. A company bought the patent of fucoxanthin, so I can make money. But it's a very small money. But I appreciate the Dr. Sang-Chan Kim. And then this is a second pathway to inhibit fat accumulation, AMPK pathway. The deoxyphosphopilotoxin in Jeonho can inhibit fat accumulation by activation of AMPK pathway. The activation of AMPK can inhibit SRBP1C and then treat the lipogenesis. AMPK, the role of AMPK is include also the inhibiting fat accumulations. The third pathway is the NRF2 pathway. The sulforaphane in broccoli, this is the representative AMPK activators. The NRF2, when the NRF2 have a stimuli, it translocated into the nucleus, and then it induces transcriptionally antioxidant agent, antioxidant genes. For example, 생강건비탕 can inhibit oxidative stress by inducing NRF2 activations. And some flavonoids, and oxyresveratrol and resveratrol, there are many NRF2 activators. This is the picture of anti-inflammations. There are so many flavonoids and herbs and herb prescriptions can inhibit inflammatory responses by inhibit NF-kappa pathway and inhibit prostaglandin and nitric oxide productions. Finally, fibrosis and cancer stage. To treat the fibrosis and cancers, we should regulate the TGF-beta pathway and the PIF and VEGF pathway. In Sauchinon, in Sanbekcho, can regulate this pathway and treated the liver cancers. The next topic is network pharmacology. This is the picture of herbal medicine. The herbal medicine, especially the herbal prescriptions, is similar with network pharmacology. So I explain the network pharmacology as an example of Shiho, Buplioladix. This is the herb, the representative herb to treat liver disease in the Oriental medicines. This is the picture of integrative network flow to investigating novel indications of BR and their potential mechanism. It consists of 3 steps. First step is this is the complete combination of target and compound network, and then comparison of compound and predictions. Yes. The last step is what is most active compounds in the herb. We can find 3 ways: the protein overlap and network proximity and the multi-scale interactons. We build compound target network for the BR and its properties. As you can see the pictures, AMPK pathway and HIPOA pathway, the signaling pathway targeted by BR, and this target is closely related to the oxidative liver disease. So we confirmed by using molecular pharmacology. MTT assay revealed the antioxidant effect of BR in HepG2 and AML12 cells. This is the confocal assay. Confocal assay and Western blot analysis confirm the effect of BR on apoptosis and ROS productions. In case of ROS, to induce apoptosis, the mitochondrial damage is essential. So we determined the mitochondrial damage, effect of BR on the mitochondrial damage. FACS analysis confirmed the effect of BR on mitochondrial damage. This is the in vivo analysis. The CCL4 significantly induced the elevation of ALT and AST level. And then you can see the pictures. This is the picture of HNE staining. The CCL4 significantly markedly induced the liver damage in the liver of mice, but the treatment of BR inhibits the CCL4's liver toxicity. The next stage is, what is the mechanism of BR's effect? This is the picture of the prediction of BR's effect on AMPK signaling. You can see the AMPK pathway by network pharmacology. AMPK is a novel drug target for the liver disease, but not only liver disease, but many diseases, such as brain and metabolic syndrome, things like that. But in this study, we focused on the liver disease. There are many therapeutic candidates against the oxidative stress in hepatocyte by activation of AMPK. The Western blot analysis revealed the phosphorylation of AMPK induced by BR treatment in HepG2 and AML12 cells in human hepatocyte and mouse hepatocyte. AMPK, the upstream of AMPK is LKB1 and KMKK. So we wanted to know which pathway is activate of amplification by BR. BR treatment induced the LKB1 phosphorylation, and then LKB1 deficient cells revealed the role of LKB1 and AMPK pathway of the effect of BR. This is the picture of approaches to identify drug disease associations. We used multi-scale interactomes. This is a calculated diffusion profile by biased random walkers and compares disease and drug diffusion profile by correlation distances. So you can see the Korean language. This is the final results of this study. We used the network proximity and correlation distance. We found the cyclosaponin A and D was very active in BR. This is the multi-scale interactomes pictures. This picture revealed the mechanism of cyclosaponin A actions against the oxidative liver injury. Molecular pharmacology also revealed the effect of cyclosaponin A in the aspect of antioxidant. Cyclosaponin A was very similar with ICAR and metformin's effect. To investigate transcriptome-wide effect, we identified the DEZs, daggers, induced by cyclosaponin A in the HERB databases. This is the left side is network pharmacological analysis, and the right side is molecular pharmacological analysis. So this is the last picture of the presentations. We can use the strategy for the selection of medicinal herb to develop a nutraceutical and pharmaceutical to treat human disease. We can use traditional allergy as well as high-throughput screening system based on the molecular and the network pharmacology. Someday, we can develop drugs by using herbs. Thank you for your attention. Thank you.